Welcome to a special short segment of the Social Workers Radio Talk Show. I'm your co-host, Alyssa Lotmore, LMSW, here at the University at Albany. Today we have Marie Dolfi, who graduated from the University at Albany School of Social Welfare back in 1983 with an MSW, so one of our alums. She has worked in numerous settings, such as adolescent inpatient units, outpatient practices, day treatment programs, all before she opened her own private practice specializing in adoption issues in 2007. For over 25 years, Marie has committed herself to learning about relinquishment and adoption issues by attending conferences and workshops, reading research and books, and learning from adoption triad members who have shared their stories. Marie regularly presents workshops for the adopted families of the Capital Region Support Group and runs a monthly adopted teen discussion group for the organization. Additionally, Marie has presented the workshops at state and national adoption conferences. So we're really excited to have Marie here today to talk about this important topic of adoption. So welcome. You have quite a resume that you've already shared with us. So I'm really excited to have you here and talk about adoption. You're going to be doing an upcoming workshop for the CEU program. And this is going to be a little bit of an introduction to that for those in attendance and for those who can attend on February 10th. This will be a sort of a little overview to give the basics of adoption. So I understand there's a shortage of adoption competent professionals. And how did this happen? You know, we think about social workers and just different individuals who are working with families who are adopting. What are they lacking, or where is the base lacking for this?
Well, thank you, first of all, for having me out here, because as I said, there's not enough people who have adoption-specific training, and unfortunately, there's some social work practices that were done that weren't evidence-based that's kind of promoted people not having the education needed. What happened is back around the 1920s, they started sealing birth certificates. And this message started, raise the child as if they were born into families. Prior to that time, we had maternity homes with women who had untimely pregnancies who could live there, get skills, childcare was provided, so that if they wanted to parent, they had the supports to help them get on their feet. Or adoptions happened by networking. The families would know somebody, or a friend, the doctor, somebody would help them find a family to raise their child. So when we started sealing birth certificates, we started pretending the first parents were bad, which is not fair. Untimely pregnant doesn't mean you're bad. I mean, this happens quite a bit. And caseworkers started matching kids, not based upon what would be a good match, based on personality and resources, but based because everybody looked alike. Oh, yeah. And we have real clear records that case managers would tell adoptive parents, raise them as if they were born into the family. The less you talk about the birth family, the better. If your kid asks about their birth family, you must be doing something wrong, which there's no evidence about. First parents were shamed. They were told they could not have any contact with their kid, when in fact we know that a lot of adopted individuals and adoptive parents would welcome that contact. Mm-hmm. Right? It's the kid's extended family. Yeah. When we get married, we don't say to our spouse, you can't have any contact with your family. Mm-hmm. Just because somebody can't parent doesn't mean they don't have something to offer. Yep. So that's why we have open adoption now. And so case managers even stopped giving adoptive parents the background information on the children, the first parents. Sometimes they were told the birth parents died in a car accident.
And they did not.
And they did not.
Wow.
And so this has happened in international adoption, foster adoption traditionally, and domestic private. Mm-hmm. So when we talk about identity issues, no wonder people are finding their identities more complex. You got the first parents who were shamed, not given services, told to get on with their lives. You got the adopted individual trying to come up with a positive identity with a lack of information.
Now, for the adoptive parents, you had said that many probably would welcome their birth families involved. Do you think that, in the case manager's view, it was sort of maybe if they felt that if they said, oh, the parent is not going to come back into the picture, that it was sort of would help the parent and make the parent feel better. That what was the reason for sort of saying, oh, the parent's not dead, or the parent's not going to come back for the child, or the parent doesn't know who you are? Is there a reason that they were pushing that instead of just saying the parent couldn't take care of the child, but this is the child now, raise them as your own?
I think part of what happened is back in the 1940s, we really didn't educate adoptive parents before they adopted about how to explain relinquishment stories, how to parent. I mean, adoptive parenting just means it's more complex. It's not less than. So instead of working with the adoptive parents where we try to do today, so those who are out there who have the training on this, we talk about adoptive parenting tasks, whether it's transracial adoption, how to manage relationships with birth families. Instead of giving the skills, they just said, don't worry about it. It just wasn't very evidence-based. So what's happening today more in domestic private adoption and foster care adoption, hopefully people are making an individualized assessment and saying what level of contact with the first parents would be most appropriate. So the adoption agencies that I work with to do home studies around here are pretty good at that. They educate the prospective adoptive parents on what open adoption relationships look like, ask for their preferences. Most of them will say you minimally have to send letters and photos, even if the first parents don't ask for them.
Oh,
Okay?
really? Okay.
So that's a trend that's very positive. I don't do a lot of work with families that have adopted from foster care, but my understanding it's a case-by-case, I should say county-by-county practice about, I think there's one local judge who says, nope, we don't do open adoptions in my court, which is unfortunate because just because you can't parent doesn't mean you don't have something to offer.
Yeah.
You know, sometimes they're living difficult lives, the first parents, but that explains why the relinquishment happened.
Now, that leads to my next question, sort of about these assessments. How are the relinquishment and adoption assessments different than maybe a traditional type of assessment for a family?
So for a birth parent, you would really want to see how much they've been traumatized by not grieving, because if they were told they did a good thing, move on with their lives, they haven't been necessarily given the support to grieve. We know that a lot of them have symptoms of post-traumatic stress disorder, and yet the DSM-5 does not include the relinquishment of a child, whether voluntary or involuntary, as a condition that warrants that diagnosis. Because we told them they did a good thing. If you do a good thing, you shouldn't be sad. Well, it's usually one of the most significant life events for a first parent. Mm-hmm. So we really need to take a look at how the grief, PTSD, and the lack of supports have really impacted them. Maybe look into, is an open adoption relationship a reunion, something that could help them with where they're at.
Especially just thinking of some families, if the child goes into a home that they're like, well, the child's in a good home, that move on, how does that parent then the birth parent process all that? Well, I should be happy because my child is getting something maybe I couldn't offer at the time, but at the same time, why do I feel like this? Like, why do I feel like this piece is missing or something?
Right, and we know that grief work, from our grief work, that the loss of a child, whether it's a first parent or a parent who had a birth child, biological child, the grief doesn't get better over time. So it really impacts them. If you're working with an adoptive family, what I would do is I would say, what happened prior to the child joining the family? Were they abused? Were they neglected? Did they live in an orphanage? Were they exposed to alcohol prenatally? Or is the child's chronological age match their developmental age? Because a tradition, when I was here, we take a systems look, and if the kid had some pretty acting out behaviors or some mental health issues, well, there must be something wrong in the family system. How'd they get there? Well, that's not necessarily true with the adoptive family. I mean, we know when kids are traumatized, they've got significant behavioral problems or emotional problems.
Now, your upcoming workshop is on identity issues. And what makes identity more complex for the adoption family, like all the members of the adoption, the birth parent, the adoptive parents, the child? What's complex about the identity issues?
So for the first parents, it's tough because they're a parent, but they're not parenting. So what do you say when somebody says, how many children do you have? How do you not take on the shame, the second-rate messages that people give to them? Yep. So identity is more complex because they're not supported.
And that's something I would even think of, because you might not even know that that person had a child that they
Right.
had given up for adoption. So it's a common question that people ask me all the time.
Right.
And you don't think of how that could impact a person and what they must process every time that question's brought up, because it really is a common question.
It's one of the first things people ask people.
Yeah.
And that kind of makes me think of adoptive parents. So many times we get told, well, you're not the real parents.
Mm-hmm. Yep.
Even though, people go around saying, oh, blood is thicker than water. And we know that's not true. People are more attached a lot of times to their spouse than they are to a lot of other people. Yeah. But people tend to think of as adoptive families as second rate versus a second choice. Mm-hmm. That's just is a little bit more complex. Yeah. For the adopted individual, it can be really tough. And all these issues depend on the person's personality and life experience. So some people may not struggle a lot with identity issues. Mm-hmm. But if someone who has the personality and the life experience, it's a little bit harder. So for the adopted individual, a lot of them don't have photos. Yeah. For the kids who were orphaned, whether it was in China or safe haven, adopting community's not too happy with safe haven policies, you don't have a photo. You don't have a story. You don't know your mannerisms. You don't know your medical history. You go to school. You can't do the assignments. Mm-hmm. It really can take a toll on some people. And I hear that a lot when especially the teens I work with. And that's why a lot of people do the search and reunion. Mm-hmm. Not everybody's looking for relationships. Some do. That's great. But a lot of them just want their answers so they can have a more complete identity.
Does it change if a child was adopted as a 1-year-old versus, I'm assuming the earlier, is there the less identity issues if they're adopted at 1 versus if they were in foster care until they were 12 and then adopted? If they have that from when they were kind of as early as they can remember, having that adoptive family be their, the only parent they knew, does that help with the identity issues or still?
Information helps.
Information, okay.
So we know open adoption helps the first parents, the adopted individual, and the adoptive parents. We know adoptive parents have a higher rate of feeling entitled in open adoption. What happens when the kids are in foster care, if their life story was maintained, if people created a life book, if they kept connections with their communities, their relatives, then they're not missing the information. But when kids get bounced around a lot, their stories, their family history gets lost. So more information, the better. One of the things we still need to work on is getting photos for the individuals today that are adopted. Even today, we've got a lot of adoptive parents meeting the first parents at the hospital in private adoption, and nobody's taken a picture.
Wow.
I think everybody's feeling it's very tenuous. We're worried she's going to change her mind. It's too hard of a day for her. Or maybe she just wants to go back to her life and she's okay with just letters and photos to the agency. And these kids don't even know who they look like. So we're getting there, but photos and information are key.
And I've been seeing how you were just talking about people are trying to find their families maybe for information or their birth families. I've been seeing a lot on social media. Actually, a person that I went to school with, I never even knew that they were adopted all these years ago, and they're trying to put that, holding the sign. I was born here. And I've seen a lot of those. Is this sort of a trend? Where not a trend, but like where people are really using all different methods to find their birth families? Have you seen a change over the years, especially with the rise of social media, of people trying to find their families more openly?
Absolutely. It's everything from people posting out there. This is what I know. I'm trying to find my relatives, whether it's the child they placed or the adopted individual. Social media is having a huge huge impact because the original birth certificates are still sealed. People aren't getting their adoption records, and if they can get it from the agencies, a lot of it's been redacted. So Facebook has really changed things. Every now and then I get a referral and a new client because we have a teenager who is finding their first parents online, making contact. These kids have their own cell phone. And then all of a sudden the parents call me up and say, you know what? I knew they were emotional more lately. Their grades have slipped. They're arguing more. They found their first parents on Facebook. And they're just totally overwhelmed. We need to come in.
Yeah.
And I think whether it's a teenager or even adults who I work with, it can be a very positive thing to do a reunion, but it can be one of the most emotional experiences ever. And it can take a year or two for people to actually sort it all through because they're rethinking their adoption story. They're rethinking who they're like. They're rethinking family fit. They're rethinking, how do I incorporate these relatives I found into my new family? It really takes a while. So if people, social media, the internet is making it so, Ancestry.com, 23andMe, people are uploading their DNA and they're finding their birth relatives. And it's really a very emotional experience. So if somebody wants to do it, they should get counseling for because there's no mentors out there. There's no support system for
You're doing
people.
it on your own.
That's
a scary thing. Just you think it's, I can do this on my own. I have all these resources and tools at my fingertips. And you don't really think of, okay, what happened if I find something? Then what?
Right.
I'm by myself. So do you find there's a difference between domestic adoption and international adoption, or is it the youth or the individuals who are adopted? Do you find that the identity issues might be the same, or is it different for like a domestic adoption versus an international adoption, or is the issue still?
I think the one issue that's not so much international versus domestic, but the one issue that makes it more complex is transracial adoption.
Okay.
Because, and I'm going to say a generality here, but white adoptive parents often don't know what they don't know about race. So they don't know how to talk about race. They don't know how to talk about white privilege. They don't realize the extent that they need to go, that they need to do more than go take their child to culture camp once a year, that they can't just say, I don't see my child as Chinese. I don't see my child as black. They're just my child. When the outside world sees them as a minority. And so I think the agencies have gotten much, much better with teaching the prospective adoptive parents on their parenting task to promote a positive that, no, I haven't just adopted transracially. We are now a multiracial family.
Yeah. And that's sort of right. Like, that's just some of the people even in my circle, there's a lot of the transracial adoptions. And that's sort of why I asked, because I'm seeing it more and more, just like I said, in my own circle, in my own neighborhood. So I was just curious about that.
Yeah, and that's one thing I'm definitely going to go into on the workshop next week, is the parenting tasks that are involved, why that creates more complex identity formation, and how to help people.
And we're going to wrap up with my last question. Where can social workers go to learn more about adoption and relinquishment issues, and how can they contact you if they're interested in finding more about the different types of counseling? What resources do you have for us?
Well, I'm going to mention a couple, and I'd like to say there are links to all of them are on my website, so I'll give my website. My website is www.adoptioncounselingny.com, or you can Google Marie Dolfi, and hopefully I'll pop up. For families, the big resource out there is the Adoptive Families of the Capital Region. And so they've been around with different names for over 50 years, and they have social activities and workshops for adoptive families. So it's a wonderful, wonderful resource out there. And I think when people get involved in that, they're less likely to end up in the clinical population because the parents will know the extra skills, the families will have the extra supports. Recently, the Office of Children and Family Services has started funding post-adoption programs, which is huge. And the one local is run by Parsons.
Okay.
So if you're looking for some support, there's also Parsons. The big Adoption Foster Care Conference, that's every May here at the Marriott on Wolf Road, is organized, and they've been doing it for over 20 years, the Adoptive and Foster Family Coalition, New York. It used to be called New York State Citizens Coalition for Children. And it's a wonderful program because it has foster parents, adoptive parents, and adoption professionals there. So it really has an awful lot to offer. It's usually the Friday and Saturday before Mother's Day every May. And NASW, New York State, just invited me to do a workshop too. Okay. So I'm doing my workshop working with individuals whose lives have been impacted by adoption on February 23rd. And
congratulations.
Thank you. Well, I'm excited because that's like a really good overview for a lot of the things we've been talking about. And I'm thrilled that more people are getting, if we can get them in to learn the first step about how it's different, then people will then start asking questions and go to more of the trainings.
Well, it's really important because if you're invited to it means that this is a topic that people want to know about. It's seen as a value.
Yes.
And that's something that's really important. It's one thing when you have a topic and you think it's important, but no, when somebody's inviting you to talk about it, it means that other people are really want these resources. They want to know more. Right. And that's a really good sign because like I said, the adoptions, just from people I know, it's definitely, I've seen, I don't know if it's an increase that just I'm noticing, but I think that adoptions becoming a little bit, is it increased recent in the past few years, or the amount of people who are adopting or considering adoption or through foster care or domestic or international?
I think what's changed is people are talking about adoptive families may be more complex, and we don't keep it a secret, though every now and then I hear of somebody who's raising a child or there's an adult who adopted whose parents haven't told them. Still, that's a big problem we have. But a big problem, but not a high in numbers. Big problem because that's really wrong. Foster care, more people are coming to me and they're interested in foster care adoption, which I think is really good. People are understanding that their children need homes and that they can get the skills to help be very successful in parenting children who spent time in foster care, who possibly were neglected or abused. International adoptions are way down. And the reason is that there was the Hague Treaty on Intercountry Adoption a number of years ago, and countries are required to promote domestic adoption. So countries like China and South Korea have been promoting domestic adoption. So international numbers are down. Domestic private, nobody keeps statistics on that because adoption is run by state laws. So there's no one organization collecting the data. Some agencies tell me it's slowed down. Others agencies tell me it's doing about the same. But I think we're just more open about it, so that's why you're hearing about it more.
And that's a good sign.
Right. Years ago, they would tell, the caseworkers would say, well, this kid's not adoptable. And that's not acceptable anymore. Yeah. We need to have services. We need to train the families, and every kid's adoptable if you just find the right match of resources, supports, and parents. We can find a home for everybody.
I really thank you so much. This is a topic that's always interested in me, and I'm really gave a lot of great information, especially just about the training and that there are resources out there, and I think that's the important part. Sometimes it seems so overwhelming when you think about adoption, and you just think of, I couldn't handle that, or I don't know what to expect. And the fact that there are resources, there is counseling, there's tools and trainings and workshops that people can feel more comfortable with taking that step, or if they have adopted, that there's resources out there that they can be connected with to help with identity issues, or when their child wants to go on social media and post to find their birth family. And how does the adoptive family feel about it? There must be some sort of emotion with that too.
Absolutely.
Maybe even worry for the child. What happened? What if they find something that they are not happy with? So just the resources that you provided today and the information, this was a great overview, and I really do thank you for speaking with us today about this. And you're going to be here again on February 10th at the University of Albany. And then what day for NASW? Or your February
23rd.
23rd. So lots of information, and thank you so much.
Well, thank you. This was a great thing for me to do. I'm very happy you invited me in.
Again, this is Marie Dolfi, and I just want to have your website one more time.
www.adoptioncounselingny.com.
Thank you so much.
Thank you.